title of my research paper is Music Therapy and its Effect on Anxiety and Depression. When I was a young child, my mom had major open heart surgery, and one of her friends came over and brought over some music. I have vague memories of my mom laying on the couch to recover. I was 5 years old, sitting next to her, and different music would be playing for my mom, and she would lead her through breath exercises. Years later, I found out that she was a music therapist, and that had always left me curious of what exactly is music therapy, and what can it help? Is it successful? So I explored the research that has been done on music therapy's effect, particularly looking at anxiety and depression. I probed the question, is music therapy proven to be a successful means of treating anxiety and or depression? There were numerous studies that had been done. I thought at first it would be helpful to define what is music therapy. Choi, Lee, and Lim in their paper define music therapy as a controlled use of the influence of music on the human being to aid in physiological, psychological, and emotional integration of the individual during the treatment of an illness or disease. So what is it? Well, it's therapists who've completed a bachelor's degree or higher in music therapy from one of the approved programs of American Music Therapy Association. Musical therapists complete over 1,200 hours of clinical training. The studies that I looked at were particularly in different areas in the medical field. The first one was in ICU or critical care, and that study looked at different trials where patients underwent music therapy while either on mechanical ventilation or while it was being removed. The results of the trial were that patients reported, the ones who received musical therapy reported lower pain, and they had a lower respiratory rate. The second study I looked at was on dialysis, and dialysis is for patients who are facing end-stage renal disease. A study was done on 40 patients receiving dialysis. 20 of them received music therapy while receiving the treatment, and the other 20 was a controlled, received no treatment. And there was a significant decrease in reported depression, anxiety, and the stress level among the group that received musical therapy compared to the one that had not. The next study was psychiatric patients. There were 3 different musical therapists that conducted trials in psychiatric hospitals where patients were receiving treatment for bipolar disorder, anxiety disorder, psychotic disorder. And again, the results of the trial showed that music had a positive effect on stress responses of anxiety and reported improving mood. The final trial was on Alzheimer patients. It is particularly on the rise in our world, making it a major public health crisis. And the study done there, the results were, again, that music had an effect on anxiety and depression. There are also some surprising finds on this particular trial. I'm going to jump to that one at the bottom, but Alzheimer patients with the musical therapy actually had an increase in being able to recall autobiographical memories and images from receiving the music therapy. So it actually improved their cognitive ability as well as their emotional well-being. Jumping back up to the top, it was just fascinating to clear up any misconceptions for myself on what is not music therapy. So a piano player in the lobby of a hospital, yes, that provides great ambience, but it is not considered music therapy. An art educator is not a music therapist. Choirs singing on the hospital floor or in a nursing home is not considered music therapy. Just simply putting on headphones on an Alzheimer patient with music is not music therapy. Again, it is those individuals who've completed their bachelor's and have that clinical training and know how to assess their patients and meet their needs. So to conclude, the research is there. It supports that music therapy is a successful non-medical form of therapy to reduce anxiety and depression. In a number of studies, it was mentioned that hospitals are looking for ways to reduce medication. And the positive success from these trials and these studies should just continue and continue to be explored to see how this could become a part of standard procedure for hospital patients. Thank you for listening.